Hi, from England. My name is Emma Watson. I, until recently, was the peer support lead for a mental health trust, NHS Mental Health Trust, and I am also the IMROC programme lead for research, evaluation, publications and development. And thank you for inviting me to talk to you about what peer support looks like in England. I worked as a peer support worker myself in 2010 when peer support was beginning to be established in England. And since then I've done a lot of peer worker roles and peer lead roles, and I also did my PhD in peer support, and I was very interested in how peer support was affected by the organisations that peer workers were employed in. So a bit of the background of peer support in England. Peer support, I guess, has risen in popularity because of a number of threads coming together. So there are survivor and lived experience groups that have really long campaigned for the inclusion of peer workers in mental health services and wanting to see people with lived experience being in support roles because they acknowledge that facilitates their recovery. And alongside that, there's been a lot of involvement initiatives. So recognition of the value of lived experience in lots of different ways in mental health organisations and in third sector charities and NGOs. And then more recently, IMROC, which is the charity that I work for, in around 2009, 2010, based on their witnessing of the benefits of peer support and peer support training, they began to recommend, campaign and support the employment of peer support workers across mental health trusts in England. And they really wanted peer support to be part of driving forwards a culture change in mental health trusts towards more recovery focused, more mutual ways of offering support. So the first peer workers in England were employed in around 2010, and that was when I was employed. They were employed in very small numbers, and they were often champions in mental health organisations that ensured that they were employed. And it was that started a ripple effect of peer support workers. So IMROC provides a lot of free resources, consultancy and briefing papers to support the employment. And then the evidence base of peer support began to build. We began to understand that peer workers benefit the people receiving peer support, receive benefits themselves from being in a peer worker role, and also change the culture of the organisations that they're employed within. And then we began to see peer support appear in policy, be recommended by places like the King's Fund and think tanks like that. And then there became more of a national recognition of the importance of peer support within workforce plans. And NHS England, which is a national, a central body for the NHS, began to fund training for peer support workers, which created a massive push forward in the number of peer workers that we saw. So we also have a national competency framework in England for peer support workers, and we have national training providers, including IMROC, and there is also an apprenticeship scheme for peer workers, which is an alternative way of peer workers being trained using a work-based 15-month programme. So all mental health trusts now employ peer support workers. All mental health trusts, not all NHS trusts. Most peer workers are employed in mental health services in inpatient and community settings. Also in crisis settings, which we know is a really powerful place for peer support. Less so in child and adolescent services and in older people services, less so in carer services, but not unheard of. And the same in drug and alcohol services. So there is a growing peer workforce in those places. Most trusts also have some form of senior peer support worker role, but not every trust, which is an important point, especially when it comes to the challenges of peer support, because I think peer support only thrives where there is good leadership and good lived experience leadership. And I think some organisations understand that better than others. And what I would really like to see is more senior peer roles, more lived experience leaders, more directors of lived experience, really championing this idea that lived experience shouldn't be about employing peer support workers. It should be about peer support workers being one element of a lived experience workforce. So I would love to see more career progression for peer workers into those senior peer roles. But I think the other challenge that peer workers face, and actually that all workers face, is that the mental health system is really under pressure at the moment in England, and there are a lot of funding cuts and there are a lot of challenges for staff in terms of high staff turnover, high levels of burnout, and it makes it a very difficult place for anybody to work and a very difficult place for the values of peer support around emotional safety and compassion and intuitive relational ways of working to thrive. So I suppose in the future I would love to see more championing of peer approaches and more acknowledgement that all staff can work to those peer values, and actually it benefits the whole system if we can embrace the values and embrace lived experience roles in lots of different ways. So thank you so much for having me, and enjoy the rest of your day.